Hi, I'm Conrad Fischer, and this is Routine Miracles. And I am here with a guy who has clearly seen the 1960s movie Fantastic Voyage maybe one too many times. Dr. Sandeep Mangla. What's your proper title here, Dr. Mangla?
Well, I'm the director of Interventional Neuroradiology.
Someone came in here with a stroke, a clot, an embolus, a clot of blood that flies off to the brain. That if they came in here in a timely fashion, within 1 or 2 or 3 hours, that you could conceivably go in there and actually go in and retrieve the clot and pull it out. Actually coil it up with, what's it called, the appropriately named Mercy catheter?
Yeah, the Mercy retriever, yes. And the Mercy stands for Mechanical Embolus Removal in Cerebral Ischemia.
Wow.
Right. It's probably got about a 50 to 70% success rate where we didn't have many options before in removing a critical blockage in one of the arteries in the brain that is causing someone a very severe and devastating stroke.
The other thing is I also is very impressed by the idea that clot-busting drugs, thrombolytics, clot-buster drugs that normally we only give intravenously and can cause side effects, that you are actually able to deliver those clot-busting drugs right into the brain with a catheter right in the brain?
Yeah, that's true. Acute stroke is one of the biggest challenges that we face, I think, in healthcare. It's the third leading killer in America, the second leading killer in the world, and up until the last decade or so, we didn't have many options. We could give intravenous thrombolysis, and we still do that. It's a standard of care for patients that come in a timely fashion within 3 hours. But most patients, probably 95% of patients, come in later than that.
Right.
And they come in
because they don't feel the symptoms.
Yeah, exactly.
In other words, chest pain wakes you up in the middle of the night because it hurts.
Right.
But stroke presents with weakness or numbness.
That's true, and I think that's one of the problems. You don't get woken up, so you out of your sleep, so you end up sleeping through your stroke, and often we don't really know when your stroke started, so you're not eligible for many treatments. That's one of the problems. The other problem is that people don't really know what the symptoms of a stroke are, as you say. Numbness or speech difficulty or minor paralysis, which is often the warning sign that a stroke's coming on, often get attributed to being tired, to maybe my arm falling asleep.
Right.
And so you don't come right away. You kind of wait, and then only when it becomes a full-blown, well, now I'm paralyzed, do you come, and that often it can be late. And I think that the interventional options are in a prolonged window. We can do them up to 6 hours. We're FDA approved out to 8 hours with several different tools, and we have an opportunity, to reverse the blockage, remove the blockage, and restore blood flow to the brain.
There's also the penumbra.
The penumbra catheter, is essentially, it's like a vacuum cleaner. It's a suction catheter. They developed a little wire with a bead on it, which essentially unplugs the catheter. Because the problem we were having with suction catheters before was that they would get plugged up with the clot. We could start to vacuum up clots in the brain
Vacuuming
arteries.
up clots out of my brain, basking them out in locally administered thrombolytics.
That's right.
Just imagine what they'll be in 2 to 4 more years.
I think it's an exciting time in medicine. I think that we have a lot of options. I think it's a matter of putting these options, in developing the infrastructure and the resources and publicizing them to the patients to get to the hospital as quickly as possible to avail themselves of the latest in therapeutic strategies. I think that there's a tremendous opportunity for progress in many cases, and I think you're, Dr. Fischer, are really doing a great job.
Me Conrad.
Conrad, and doing a great job in learning about all these things, and I think that it's just a matter of getting everybody to know about them and to take advantage of it.
Terrific. Thanks so much for telling us about this.